Hello and welcome to another social media live from the World Health Organization. My name is Walter Owens. I'm a social media officer here at the WHO. Today is the last day of the World Antimicrobial Awareness Week. And today we're going to talk about, you guessed it, antimicrobial awareness. And I'm joined today by Dr. Hanan Balki. Hanan, would you like to introduce yourself briefly?
Hello, everybody. It's a great pleasure to be with you on our last day for the World Antimicrobial Awareness Week. I am Hanan Balki. Just to let you know, I'm a pediatrician, infectious disease specialist, and an infection control person in my previous career. I'm very happy to be with you today to answer as many questions as possible.
So we're glad that you are joining us today. For the people watching us on Twitter, on Facebook, or anywhere else on social media, feel free to ask questions. If you're on Twitter, just use the hashtag AskWHO. If you're on Facebook, LinkedIn, just drop a question in the comment section. We'll be monitoring the questions and we'll be prioritizing the ones that are related to AMR and COVID. And maybe just to start off, Hanan, as a first question, what is actually antimicrobial resistance?
That's a great question. Thank you. So antimicrobial resistance is a characteristic specific to the pathogen itself. And let's focus today on bacteria, although resistance can happen in parasites, viruses, bacteria, and fungi. We're very concerned about antimicrobial resistance, specifically among bacteria. So it's a characteristic of the pathogen itself, where it uses its basic genetic material to ensure that it survives any hostile environment. A hostile environment to a bacteria, which is a single-celled organism, is when the pathogen wants to when the agent or the antibiotic, like penicillin, augmentin, whatever agent is being used, is to stop the growth of the bacteria or to kill the bacteria. So resistance is when the pathogen itself resists to die when exposed to the antibiotic.
I see. So overall, it's a very important topic, and it's been in the news quite a lot throughout the last couple of years, especially. Why is it such an important topic?
It's very important because the discovery of antimicrobials and antibiotic penicillin specifically years ago in the 20s was a revolutionary drug to and a group of drugs eventually that really revolutionized how fast modern medicine progressed. So our ability now to suppress the immune system by doing transplant, by giving chemotherapy, and even doing major invasive surgery without the use of antimicrobial agents, we're not able to do that. So antimicrobials are very important global goods, if you will. They are extremely valuable, and we want them to continue to be effective so that we can continue to treat infections in human, that's specific for human health, and that we can continue to progress with modern medicine, but also to prevent simple infections, and that we do not die from a simple cut because it got infected and the person went into a major septic shock or whatnot. So that's why it's very important.
And we both mentioned World Antimicrobial Awareness Week in our introductions. Today is the last day of that week. Would you like to give us a bit more information about what this week is about and what we're doing during this week?
So as many health topics, the WHO works on developing a specific day or a week or an event to recognize the importance of a specific relevant entity. The antimicrobial awareness is one of the major pillars of the Global Action Plan for Antimicrobial Resistance for the countries for all of us to be able to address this topic. One of the 5 main pillars is to be aware of the problem. Your first question, what is antimicrobial resistance? Why is it important? And Antimicrobial Awareness Week this year has been revamped, if you will. We've been doing it for several years now. This year, we really had a major engagement with with the tripartite, with FAO and OIE, and with partners from multiple different sectors to make sure that we do it in an inclusive way and that we fix the dates. So we're going to have it every year between the 18th and the 24th of November. So that's one major issue. And also that we've made sure that we've created enough educational material, webinars, activities, and to work with our partners around the world and member states as well to increase the awareness on antimicrobial resistance.
I see. I remember a couple of years ago, I think the focus was more on antibiotic awareness week and antibiotic resistance. And now it seems to have shifted to antimicrobial resistance. Is it the same thing or is it something different?
So antimicrobial is more broader because now you're talking about agents that are used against fungi, viruses, and parasites, while antibiotics is mainly for bacteria. So again, we do suffer not only from the bacteria that cause infections in the healthcare setting, but also there's issues with resistance among tuberculosis, among human immune deficiency virus, HIV, among malaria. So this whole issue of resistance is really something that needs to be tackled in a holistic manner. And many of the interventions needed to prevent the transmission of these diseases and the emergence are the same. So it makes a lot of sense that we use as much links, if you will, between the different programs and the different pathogens and the different diseases, because sometimes, for a basic example is infection prevention and control. It's the same interventions that we need to do for all of for preventing the transmission of all of these diseases.
Okay. So basically it's not quite the same. It's just like an umbrella name that, that has a broader spectrum of things within it. I see. Yes. And is there something that people can actually do, individuals can do to prevent antimicrobial resistance? What can individuals do? And also what causes antimicrobial resistance? I know it's quite a broad question, but maybe you can give us some tips of what individuals can do.
Yes, because those are two huge questions in one. So let's tackle them one at a time. What can individuals do? I think, first of all, to be aware a little bit. I mean, we don't want people to turn into basic scientists, but at least to understand that, first of all, antibiotics are agents. They are pharmaceutical agents. They're chemicals foreign to our body. So by taking them, you're actually introducing or exposing your body to a foreign agent. I like to simplify it to my audience is that we don't wake up in the morning taking an antihypertensive medication just in case I have hypertension. I don't take an anti-diabetic agent just because, or insulin, just because I may have diabetes. So it has to start with a diagnosis. To take an antibiotic, you have to have an infection or a suspected infection at least. And that needs to be done by an expert certified healthcare provider. So I think the first thing that the individuals need to know and people need to understand is that antibiotics are not, they're not vitamins, they're not natural products that we just take them to strengthen our immune system. They are given to specifically kill or stop the growth of the bacteria. When we know that part of that piece of information, then we realize that we should not be sharing antibiotics. If it was prescribed to any of you by a physician that you have leftover, you use it a month later, you give it to your loved one, to your neighbor, to your relative. Those practices do take place. So we need to understand that you need to be given it through a prescription. So I'll stop here as two basic requests.
Yes. So basically, antibiotics really should only be taken if a doctor prescribes them to you, and you shouldn't share them with anybody else, and you should only take them if they actually make sense. So for instance, if you have the flu, it's no point taking antibiotics. So I think, yeah, there's a lot of things that people can do to be careful about not increasing antimicrobial resistance and antibiotic resistance. Now, you mentioned earlier that diseases will be more difficult to treat, and probably also surgeries will be more difficult because of AMR. What's the impact on patients that antimicrobial and antibiotic can have on individuals as patients?
So again, these are tools, if you will. These are that need to be available for the healthcare provider in case the patient develops an infection, so we can treat them with. So you can imagine if a person goes in for an appendix surgery, or goes in for removal of their gallbladder, or goes for a major cardiac surgery, for example, or a small child who is just having a fever, cough, and needs oxygen because they have a lung infection. Those types of patients, if we do not have the right tools, the right agents, the right antibiotic to treat them with, we will lose them. So that's where we have a major challenge in using them well, so that we do not abuse them. When we say using them well, that there needs to be the diagnosis. We need to choose the right medication. We need to give it in the right dose. So giving it in the right dose is important. The right frequency, completing the course of the antibiotic. So if you're given 5 days, finish the 5 days. You're given the 7 days, finish the 7 days. And that you stop them when as prescribed by the physician. So those are the main ways of giving the antibiotics.
Okay. And antimicrobial resistance, how can it affect somebody who's a hospital patient? What are the threats for patients, the possible threats?
So first of all, I think we need to understand that where do the bacteria come from? The bacteria can, first of all, we live with bacterial cells of different types of bacteria in our system. They exist in the orifices of the body, the nose, the mouth, the anus, the lower part of the urethra, also on the skin, around the eye, around the external part of the ear. So we do have bacteria in us. If we take an antibiotic without it continuously, once after the other, with no good reason, we're killing off the susceptible bacteria, and we're allowing the stronger bacteria that are resistant to survive in our systems. If a person then becomes hospitalized or gets a skin cut or goes under major surgery, it's most likely that they will be infected with a pathogen or with the bacteria from within their system. So it's very important that when we're hospitalized, that our doctors have the potential and the options to treat us with. In the healthcare setting itself, it's very important because the hospital has sick people in it. And within the environment of the hospital, there are doctors, nurses, visitors, the patients themselves. There are shared rooms. There are instruments that are used on patients, like an intubation instrument, IV catheters, thermometers, blood pressure cuffs. And the bacteria, not only can they live in the human body, but they can live in the environment itself, right? So within the healthcare setting, if we are not performing good hygiene, which in our scientific world is called infection prevention and control strategies, then these pathogens can come out from a specific person and move with these vectors. The vectors are the human hands, the stethoscope, the blood pressure cuff, and they can move from one patient to another. So in a way, the bacteria do exist in the healthcare system, not to scare people away, but we need to understand that there is that risk. The healthcare institutions and hospitals and the leaders in this area need to make sure that they implement good practices in the healthcare system so that this spreading, if you will, of the bacteria does not happen.
Okay, I see. So there's actually a lot of things that the hospitals and the healthcare workers themselves have to pay attention to.
Yes.
Can you give us a couple of examples of what a hospital, for example, should pay attention to?
Yes, a great question. When available, it's very important that we, first of all, hospitals are not homes, they're not schools, they're not shopping malls. So they need to be built with basics of hygiene and infection control standards. So one of the big issues with hospitals that we worry about is the overcrowdedness. The overcrowdedness when you have too many people sharing a room. There are instances where some of the incubators for the babies that are meant for one neonate have more than one neonate in them. A room that is meant for 2 patients has 4 patients in them. So those are the basic issues of implementing the proper infection control standards for the healthcare so that the patients become at little or no risk of this transmission of certain diseases. That's one example.
Mm-hmm. I just want to say, as a reminder for all the viewers around the world who are watching us, I'm connected remotely. We're both connected remotely. That's why we're not wearing any masks. We're not sitting in the same room. If you have any questions about antimicrobial resistance, please use the hashtag AskWHO on Twitter, or if you're watching us on another platform, please just drop a question into the comment section, and we will be surely trying to answer those questions. Now, if we go back to our discussion, you mentioned bacteria, and I would like to inject our first viewer question, which is from Rashid Ali, who's asking, what is the main reason of antibacterial resistance? Is there any main reason, or is it a spectrum of things?
So I don't know whether he means what is the method or the mechanism of resistance, or what makes...
I think he means the causes.
The cause. So again, maybe I addressed it. I'll elaborate. Mm-hmm. I said earlier, the bacteria is a single-celled organism that has a very simple genetic armamentarium, or specific genetic makeup that reflects what we call its phenotype, or its characteristics, its outer presentation, if you will. And the bacteria, again, because it wants to survive, it uses that genetic material to re-engineer how it looks from the outside. So there are certain characteristics that it can portray. It can produce an enzyme that will break down the molecule of the antibiotic so that it's no longer effective. Or if the antibiotic goes into the cell, it will pump it out. We talk about efflux mechanisms. Or it distorts the outer, what I like to describe it as the windows and the doors from which the antibiotic enters into that single cell. It changes the porin, what we call, or those windows, and misshapes it so it no longer fits the antibiotic. So when will it do that? And that's the reason why will it develop resistance if it is exposed to antibiotics. So one of the major reasons why these antimicrobial resistance characteristics emerge is of exposure. So that's why we always say about the unnecessary use and exposure of the bacteria to the antibiotic will make it more and more resistant.
Mm-hmm. I see. I have another question for you from a viewer on Periscope. We kind of touched upon this already about things that individuals can do to prevent AMR.
Yes.
This question is, what are the proper ways to dispose the remaining antibiotics after completing the dose?
That's a great question, and I think we're still very behind in how to do that. So the disposal of the antibiotics, that's a great question, first of all. So number one, don't keep it in your refrigerator so that you can use it again. That's the first thing. Do not give it to somebody else to use it in case they have a cough or a fever, or what you think is a similar illness to yours, if you're not a healthcare provider who can prescribe an antibiotic. And I think we also, and you don't want to actually dispose it even if we talk about the pharmaceutical companies, they should not be disposing their effluent into the major body waters which will allow us to be exposed to it in an unintended way or without knowing about it. So some of the countries, which I think is extremely amazing, that you would return the remaining of your antimicrobial agents to the pharmacy for them to properly dispose of it. But the best way is to package it and to throw it out without contaminating major water bodies or giving it to somebody else.
Mm-hmm. That's a good point. We touched upon what individuals can do and what healthcare facilities can do and what healthcare workers can do. But I think there's also things that governments can do or organizations like the WHO. Maybe you would like to tell us a little bit about that.
Yes, thank you very much. The WHO works very closely with the two main agencies, the World Organization for Animal Health and the FAO. So from the WHO perspective, which is the major health organization, the major global health organization, we focus on, since 2015, we've been focusing on what is known as the National Action Plans, to try to simplify to the governments about what are the major areas that need to be tackled and addressed when it comes to strengthening the healthcare systems or the systems in general within a specific country to address antimicrobial resistance. So we talk about how first of all, we have to address this in what is known as a multi-sectorial. So the Ministry of Health has a role, Ministries of Agriculture, Environment and Water, the Food and Drug Administrations, all of them have a role that are exemplified and described in our guidances. The WHO also provides technical assistance for the countries to establish and help in guiding for capacity building, human capacity building and infrastructure capacity building as well. I want to, maybe it would be a good time to just say that we've finally reached a major, what I would assume is a milestone in addressing AMR. We don't have the solutions. We're not going to fix this tomorrow. But at least last Friday specifically, the director generals of the three agencies I had mentioned, which are also known as the tripartite, have actually announced the establishment of the Global Leaders Group, which is headed by two prime ministers, the Prime Minister of Barbados and the Prime Minister of Bangladesh, to lead this group, which is which will have a major impact on creating major awareness and bringing more support to the AMR agenda, so that the countries can establish the needed multi-sectorial responses to address the issue of AMR.
Mm-hmm. I see. And I think WHO is also involved in monitoring trends and has a big database on the usage of antibiotics and the spread of AMR. Are there any trends that you would like to tell us about, something in terms of data that you find is interesting?
So the monitoring and evaluation data is actually also owned by the tripartite. So it's done to assess the multi-sectorial response to AMR, and the reports that are published on an annual basis are available on any of our websites, the OIE, FAO, or the WHO website. And of course, COVID has slowed down the engagement of the countries a little bit when it comes to addressing the issue of AMR in their countries. But I think despite the COVID pandemic, there has still been major interest with the countries. We deal with 194 countries. So does FAO. OIE deals with close to 85 or 90 countries. And one of the trends, or several of the trends that I think are important is, a very important trend is the legislation. So what is very interesting is when it comes to, for example, the legislation of over-the-counter dispensing of antibiotics. That's something the governments really need to own, that you cannot just go to a pharmacy and without having a prescription be given an antibiotic. So some countries have legislation, but they have not implemented their legislation. And this monitoring and evaluation tool looks and compares the different countries, where are they at when it comes to legislation and implementation of legislation. The tripartite also, we had launched last week the document that talks about, or it's the compilation of the existing instruments for the proper use of antibiotics relevant to all of the sectors that I mentioned: human, agriculture, health. And so for the countries who are not aware of some of these instruments, they can adopt them. And then after that, they're going to have to do the tough work, which is implementing the legislation.
I see. So there's a lot of things have been done, but obviously it's a long-term project and there's a lot of work that still has to be done. But I would like to shift back now a little bit and take some questions from the audience. One question we've been receiving frequently is there only one type of antimicrobial resistance, or can it have different levels, or can you be resistant against different types of antibiotics?
Excellent question, and a very basic microbiological question. There are many different types of antimicrobial resistance. That's why it's a difficult topic to explain, difficult topic for a layperson to understand the intricacies of it. But as I mentioned before, the bacteria is very clever. So and again, this goes into basic microbiology. It can resistance. I'll give you some of the scientific words. So we talk about methicillin-resistant Staphylococcus aureus, right? MRSA. We talk about carbapenem-resistant Enterobacteriaceae, CRE. We have a lot of acronyms like that. But if we want to simplify this, there are four major categories of resistance. As I mentioned, the bacteria can produce an enzyme to break down the antibiotic, or it can allow the antibiotic to go into its cell, but immediately pump it out, like getting the bad blood out of that cell. It's called efflux mechanisms. Or it can change the outer membrane. It can change the porin, what we call it, the windows and the doors from which, so it prevents it from entering at the very first place. So those are some of the examples of how the bacteria can, and they're very different, they're very diverse, and they evolve. The last part that I wanted to say is that let's say that you have two different types of bacteria. They're also nasty in a way. Well, not nasty, they want to survive. Right? So what they do is that they exchange genetic material. And you can have one bug, call it E. coli, sitting next to another bug, for example, called Acinetobacter, and they say, hey, I have this amazing genetic piece. Why don't you use it in case you're exposed to this antibiotic? I don't know whether they actually have those dialogues or not, but they do share genetic material so that they can become stronger and more resilient when faced with these antibiotics.
Oh, I see. That's very interesting. We have a related question on social media. Does that mean that if we were to develop different types of antibiotics, that we would minimize the impact of antibiotic resistance because we have different layers of it, or doesn't that help developing new antibiotics?
Repeat the question, please.
Would it make sense to develop different types of antibiotics, or yeah?
Great question. I think so. The question is, should we trick? So the question is, how do we trick these bacteria? How do we be ahead of the curve so that we're developing antibiotics that the bacteria does not find a way to become resistant to it? That's a beautiful question, and it's about innovation in developing antimicrobial agents in general. Beautiful question. And I think we had produced at the WHO guidance, it's the preclinical pipeline for antimicrobial agents and the clinical pipeline for antimicrobial agents. If people or scientists would like to pick that up, it's on our website. And it also gives guidance on how to be innovative in developing these new agents. So we cannot produce the same penicillin with a little bit of a change, or we cannot produce the same cephalosporin but change. We need to be innovative in finding ways. How do I produce an antibiotic that the bacteria is not capable of developing a resistant mechanism to it? And we already have multiple classes of antimicrobials and antibiotics, but I think we're lacking the innovative part, and we need to work with the research and development platforms to be more innovative in developing these agents. And we did produce some guidance on that on our website.
Yeah, so we have to be more innovative, but also sometimes the environment, like at the moment we have COVID-19, is also rather innovative. Is COVID-19 a threat for the increase of AMR?
Absolutely. I think the COVID has so many ways. In one of the descriptions that I actually liked about COVID as the major pandemic, and I had a comment on it, is that it's dragging behind it the antimicrobial resistance pandemic. There's a reality to that, but the other reality is that antimicrobial resistance is already a pandemic. We already have resistance that is spread throughout the globe in high-income countries, mid-low-income countries, of the different faces, shapes, and forms of antimicrobial resistance. So it's already out there in huge, with huge impact. So the COVID is going to make it worse in certain ways because it's allowing for crowded emergency rooms, hospitals. It's allowing for anxiety among healthcare providers and individuals to use antibiotics just in case they have a bacterial infection, but they're coming with signs and symptoms of COVID, which is a viral infection, where antibiotics are not useful anyways. It's also allowing for the crowdedness in the healthcare settings, which, as I mentioned earlier, will allow for poor hygiene. So transmission of pathogens, sharing of bathrooms, maybe the poor turnaround ability in laundering of the bed linen, cleaning the ventilators, the scopes, the laryngoscopes to intubate people. So it becomes a bit tricky. However, the pandemic has allowed us to focus a lot on infection control, hand hygiene, washing your hands, wearing your masks. So I don't know that we have enough literature to show if the resistance has emerged in certain healthcare settings or communities or not. And I think that science will be coming out hopefully soon.
Yes, I think that the pandemic has made us more aware of these kind of things like hand hygiene that in the long run might be able to help AMR. Hanan, this was a very, very interesting discussion about a very important topic. Any last words from you that you would like to share with our audience?
No, thank you very much. I think we want to stay vigilant. Remember, again, antibiotics are not vitamins. They're not fever-reducing agents. They are real drugs that are meant to stop the growth or actually kill the bacterial agents. So take them only when you need them. Take them with a prescription. Stay healthy, and wishing you all the best. Thank you.
Great, thank you so much. And we would like to say thank you to all our viewers around the world. As usual, we have a very long list of countries, including India, South Africa, Philippines, Kenya, Indonesia, Nepal, Nigeria, Botswana, Pakistan, Turkey, Cambodia, Yemen, Bangladesh, and so forth. Thank you very much, everybody, for watching. If you would like to know more about the subject, please go on our website. We have a page for the World Antimicrobial Awareness Week. And also in the health topic pages, you find a lot of information and the latest data and information. Please take this topic seriously, and see you next time. Take care.
Bye.
Bye-bye.